Hello, everyone. I think that we are ready for the Great Pitch Contest finals. We've been waiting for this for so long. Yesterday, we've had 50 startups pitching, and out of these startups, we'll have today CarScanner, Nutrix, Respinova, Coachum, Ligens, Teamstormer, InnoHealth, and Joint. Okay, I think that we are almost ready to be joined by our judges, but before we do that, I'll let you know where will the awards be from. So we'll have the awards from Google, from HubSpot, from Startup Grind, from F6S and AI Startup Incubator. Okay, so shortly we will be joined by our judges. Caitlin Das, Startup Growth and Partnerships at HubSpot for Startups. Grzegorz Pawlicki, Head of Innovation, PKO Bank Polski. And Szymon Kwiatkowski, Investment Manager at EIT InnoEnergy. So they should be here with us shortly. All right, you're here with me. It's working. You know, the hybrid conference is a big deal for us all to be connected. I can see that you're on mute. Okay, so that means that we are ready for our first startup. So let me just prepare the timer for them. Okay, so I can see, Sławek, that you shared your screen. You're here with us. I'm starting the clock. Take it away.
Hi, my name is Sławek Potash. I am founder and CEO of CarScanner. What does CarScanner do? Well, I'll give you 5 guesses. Yeah, you've most probably guessed. It scans cars. And let me tell you why this is important. For years, car salespeople have gotten a bad rap. They're often described as pushy and even untruthful, which puts many online car buyers on the defensive from the very beginning. There are about 6 million cars being auctioned annually in the US alone. This means 6 million cars being graded against the standard in a process which is prone to human error. This human error leads to over $1 billion loss in undetected damages every year in the US alone. Let me rephrase that for you. It is 2020. We have self-parking cars. We have hydrogen cars. We have cars in space. Yet we still have thousands of car salespeople walking around the cars every day, taking pictures of car damages and noting them on a piece of paper. This is ridiculous. That's why at CarScanner, we're revolutionizing a $100 billion industry with robotized, transparent, and consistent car documentation system. We provide our customers with embeddable player in which they can clearly see the exterior and interior condition of a used vehicle. Let me show you how CarScanner works. An autonomous robot moves automatically around the car and notes the car's condition. At the same time, we also provide interior virtual tour generation at the same time. With this technology, we provide our customers with a higher conversion rate and with lower operational costs thanks to the robotization of this process. Our competitors are huge drive-through light tunnels that cost well over $100,000, and they take over 1,000 square feet to set up. Our pricing, we are deploying our device with an activation fee, and then we charge on pay-per-car basis. As a company, we're scanning over 1,400 cars a month. We have over $300,000 in revenue. We're after POC with Porsche, and we are negotiating a distribution agreement for the US with a major automotive company. CarScanner is a Canadian company with Polish roots. We're a team of 12 people. 10 of us are engineers coming from automotive market. I'm a CEO myself, mechatronic engineer with background in industrial cameras. Isabel, our COO, is ex-KPMG, Procter & Gamble, ABB, and Valeo. And Maciek Sajdak, our CTO, has over 12 years of experience as a full-stack CTO and full-stack developer. Thank you so much for your attention. I'm more than happy to answer your questions.
Wow, you finished before time. We actually still have 13 minutes, so we can smoothly move to the Q&A session. Are there any questions from our judges? You can unmute now and ask questions. Who'd like to start?
Okay, I can start. My question is, who is your customer? Actually, the car dealers or the insurance company? And do you plan to identify the damages? And because this is quite a not a portable device, so it's not for a regular customer. It's more for the like car repair station or for the insurance or car dealer. So my question is, who is your target customer and what is your business model based on that?
Sure, that's an excellent question. So we focus with our go-to-market strategy in first stage on used car dealerships and online car auctions. So those are all those cars that are coming from leasings. After the leasing contract has expired, those cars are auctioned online. So that's where we focus. At the same time, we are working on a data sale strategy. So that way we can work with OEMs and insurance companies on selling them the big data sets around car damages, their frequency and stuff like this. And in the next stage of our development, we'll be aiming for stationary scanning points. So that way we can, for example, deploy it at car washes. So that way we can redirect P2C customers to their closest car washing station to make the inspection. And we're definitely aiming for automatic scratch, dent, and paint thickness analysis using machine learning algorithms.
All right. Any other questions from our judges?
Thank you.
Okay.
So maybe me. Slavek, could you please tell us more about the Porsche POC? Because I don't think it's a first choice customer. Why Porsche?
Sure. Because we have this data selling strategy in mind all the time, we want to keep as good relationships with OEMs as possible. So that way, once we have good enough data sets, we can reapproach those OEMs and say, hey, guys, here we have tons of data for predictive maintenance, for improvement of your products, and so on. And right now, we are also working with 2 other OEMs in pilot deployments. And this is actually in order to increase the credibility, but also to maintain good relationships for this data sale strategy that we have in mind.
We still have a bit less than 2 minutes left. Caitlin, perhaps do you have any questions for Sławek?
Yeah, I think there were some very good questions asked, and I want to make a compliment first because I think you did a really good job at your problem statement and how you pitched the company. I think also if you pitch it in the future, really emphasize that target market that you have, like the segment and your go-to-market strategy a bit more. I'm really curious at how you are currently working with that POC that you have at Porsche. How did that came about? And how are you thinking long-term about your go-to-market strategy? Because you have 2 very different kind of products that you're now wanting to sell, the actual machine and the data. Where are you going to focus? How are you going to go to market with it?
Sure. Also, excellent question. So in terms of the actual machines, we're definitely not in the market of selling the devices. We want to deploy them with very little or without any activation fee. So that way we can pretty much monetize on number of vehicles being processed. That's one thing. The data selling strategy is something that we'll be focusing on in few years' time. Actually, now our business model is 18 months from now. And also in terms of like POC, how we did make that, it's actually using plug-and-play accelerators called Startup Autobahn from Stuttgart. So that's how we got to know with Porsche team. And I would say our market focus right now is entirely on the leasing cars that are auctioned online after the contract is expired. So this is pretty much 6 million cars in the US alone every single year.
Okay, we ran out of time, but it was perfect. So thank you very much. Virtual claps for you. I mean, actually, we have some audience right here. So thank you very much. It was really a great pitch. So now we are going to move to the second startup of today. When it comes to the Great Pitch Contest, it's going to be Maria from Nutrix. Are you sharing your screen with us?
Yes.
Super. I think we're ready. I'm starting the clock. Take it away.
Okay, excellent, wonderful, welcome. My name is Maria, and it's really great to be virtually in Warsaw. And today I would like to talk with you about the future of glucose monitoring. So traditionally, glucose monitoring is uncomfortable and painful as it requires a blood sample and a finger prick. And the diabetes patients need to perform this several times a day. And diabetes is a global crisis as it affects more than 463 million people globally, number expected to increase by 25% by 2030. So today it's our pleasure to present to you the G-Sense. a stepping stone in our development. G-Sense is a non-invasive glucose monitoring sensor that detects very low concentration of glucose in saliva and sends this information to external app that keeps track also of historic data. Our sensor is pain-free, non-invasive, and integrated, as we are also building complete digital ecosystem for the management of type 2 diabetes. Our business model is product as a service with recurring revenue. We are delivering G-Sense to the patient and also with the access to our digital ecosystem and periodically all the sensors for the measurements. Where we are now, we have the prototype ready. We use half of drop of saliva for the accurate measurements. We achieve linear measurements in glucose concentration of the threshold. And we also are able to respond to glucose measurements with other molecules interfering. So we are now ready for the clinical tests that we start this month. We are also now opening the seed round, and we are preparing the product for the regulatory approval for the submission with the FDA and with the CE. Our long-term vision is to further miniaturize this technology and be able to monitor other biomarkers that are present in the saliva. And in the future, miniaturize this for the sensor on the tooth. To make this project successful, we have a great team. Jemish has experience in biomedical engineering, and he is assembling the prototype together with our partners. We met with Nikhil during the MIT bootcamp. Nikhil is responsible for the customer point of view, and I bring experience in medical devices. So we are now looking for your support. We are looking for investors, and we also want to connect with patients with diabetes. Thank you so much.
Thank you, Maria. We are already in the Q&A. You finished just in time, so it's time for the questions. Who'd like to start from our judges?
I can start. Great pitch.
Super.
Thanks so much for sharing, and really exciting products. I have a little bit of a question mark around your target market. Is it, where are you going to sell? Where do you see your biggest opportunity? And again, a little bit also about who are you selling it to? Because you're selling a product as a service. Is it the consumer that you're selling to, or?
Yes,
okay, I stop there.
Thank you. Thank you so much. So yes, in the first phase, we will be selling directly to the customer because it will be a product paid out of the pocket, and then later on we will be reimbursing the product from the health insurance. So we are starting in the markets where the customers are used to pay for this kind of product out of the pocket. So, and also markets that are less regulated. So our first market will be Chile. It's a market that is not regulated. We also received support from the government of Chile. That's our beachhead market. And then we start in Europe with the big markets in Europe, and later on in US as FDA approval process takes longer.
Okay, thank you very much. Any other questions? Or maybe Caitlin, you still have some questions?
I have a question.
All right.
Because it looks pretty amazing and solves one of the biggest problem in the world, people having diabetes. And my question is simple: do you have any or know any other companies that compete with actually researching similar things, and how accurate actually it is, whether you combine to real blood tests, and because probably many before tried to do that.
Yeah, thank you, Grzegorz. Excellent question. So it's also like we have in our pitch deck the slide "Why now?" And before it was not possible because the technology was not there. Technology from the point of view of the detection. So let's say like to be able to detect with nanotechnology very low concentration of glucose that we have in the saliva. And second of all, the artificial intelligence that allows to really be selective and be able to only detect the glucose. So this is why it's now possible that the technology advanced. We know that they are, let's say, like we've been in contact with many international universities. We know that the research centers are working on this. One of the companies that we are familiar with is in Australia. But from the research paper that they published, our detection limit is much better. So there is lots of things going on. And to finish, like many of the research centers, because of COVID, switched to the quick test for the COVID detection using saliva. So let's say like that also puts us in advantage because we stick to our glucose monitoring.
Okay, thank you. Do you have the IP rights or patented your solution?
Yes, we are currently in the process of the patent application.
Super. 5 seconds left. I think that's not enough for another question. So thank you very much, Maria. Virtual claps to you and maybe some real claps here from our audience.
Thank you so much. Thank you.
Yeah, we're here in Warsaw, in the Palace of Culture and Science, and it's great to be connected with you virtually as well. So, all right, so now we are ready for Respinova, our next startup. Yes, Cliff is here with us. Cliff is sharing the screen probably right now. It should all work. Yep. I have the timer set. Feel free to take it away.
Great. Good afternoon, everyone. My name is Cliff Hansel, and I'm the CEO of Respinova. We are solving one of the most vexing problems in medicine, COPD. COPD is a group of chronic lung diseases that affects over 350 million patients worldwide and is the third leading cause of death. We spend over $200 billion treating it every year. In COPD, sometimes the large upper airways get constricted, which restricts airflow, but more often, COPD is characterized by the complete collapse of smaller airways at the lower branches. The current way to treat COPD is using drugs, known as bronchodilators, which are just muscle relaxants for the muscles of the upper airway. These can't actually affect the lower airways, where most of the problem is, because those airways have no muscle to target. Our patented pulsator system uses a series of air pressure pulses at different frequencies that can do two things. First, these pulses vibrate their way down to closed airways, repeatedly pushing at the opening until they gently pop back open. And second, the vibrations lower the viscosity of the mucus that may be clogging the airways, kind of like shaking a bottle of ketchup. These synergistic effects are clinically proven to improve patients. In a randomized placebo-controlled study, Pulsator produced more than 4 times the increase in walking capacity than the placebo device, and more than double what clinicians consider to be a meaningful improvement in just 2 weeks of treatment. Pulsator also produced significant improvements in lung function and quality of life. And these important results were published in the Journal of COPD. We are planning submissions to the FDA and CE very shortly, with commercial launch of Pulsator planned in early 2021. And we just received our first approval by Health Canada to treat recovering coronavirus patients. Our business model is straightforward, selling devices and consumables to patients and hospitals. In some markets, we sell directly, and in other markets, we work through distributors. For example, in China, where we have a distribution partnership with Vincent Medical. We are currently in discussions with a major multinational about strategic distribution partnership covering other parts of the world. We have a top-notch team to execute on this with over 125 years of a collective experience in medical devices and a hands-on board of advisors with tremendous depth in the marketing of respiratory medical devices. Our IP portfolio consists of 15 issued patents already, with more coming down the pipe, together with encrypted software algorithms for controlling the pulsator. So we're currently raising a Series B round, which will carry us through CE mark, FDA, and Chinese FDA approval, and through launch in the US, Europe, and China. As a bridge to the Series B, we are raising $1.5 million right now, which will get us through CE mark and FDA and give us time to close the Series B. If anyone is interested, please contact me directly. I would like to conclude by thanking Michael and the organizers of the Wolf Summit. And with that, I'm happy to take questions. Thank you.
Okay, there's still 3 seconds left, but no worries. I'm changing it to the Q&A right now, so we have 4 minutes for our judges to ask questions. Who'd like to start? Okay, Shimon?
Okay, so great, a great presentation. We know that your solution could be more efficient than drug therapy, but how does it correspond in regards of cost of it?
Right. So we're not competing directly with the drug therapy because what we showed in our study is the drugs are useful to get patients to a certain level where they can walk, let's say X. And what we showed in our study is that even if these patients stay on the drugs, putting them on Pulsator improves their walking ability dramatically, even above what they can do for drugs. So it's a synergistic therapy. It's not a replacement therapy. But just to give you an idea of cost, a good bronchodilator nowadays is about $3,000 per year. If you annualize the cost of owning a Pulsator, it'll be more like $1,000 to $1,500 per year.
Okay. Are there any other questions? Okay.
Yeah, one more. And the device can be operated by a patient himself?
Yeah, it's very simple to use. You literally just put this in your mouth. There's one button to press that says go. If you want to take a break, you press pause. It runs for 20 minutes. You breathe on it normally while you're watching TV, and you're done.
Great, thanks.
Thank you.
Okay, I think Grzegorz unmuted earlier. Would you like to ask a question?
Yeah, just to make sure whether this device injects some of medicine or just use the without the medicine therapy it is.
It's a good question. So the first device is a medicine-free device. It only uses air pressure pulses, but we do have a pipeline platform of additional products which will combine the pulsing therapy with drugs. What we already showed in another clinical study is that if you combine our airway opening while you're giving the drugs, you can actually improve the delivery of drugs by about 200% versus regular inhalers or nebulizers. So that's part of the pipeline.
And what is the price of this device?
So the price, end user price, will be probably about $4,000, but it'll be spread over a monthly fee of probably about $150. Remember, these patients have this disease for a long time, and the device can last them a long time. So you can spread that cost over several years. And then there are consumables, as I mentioned in my pitch.
We still have over 1 minute. Are there any other questions from your side, judges?
I would like to ask a personal question. Why are you so passionate about this?
Besides the fact that my mother has COPD and that my quality manager lost his mother to COPD and that our founders are really all about treating patients, those are the main reasons.
Okay, thank you so much. I don't know if anybody else of the judges have still...
Just one final question. Any customers you already have in your pipeline?
So we haven't launched yet. We're just a few months away from CE and FDA, but we do have one customer at least lined up that owns about 10,000 nursing home beds, and about 20% of those patients actually have COPD. And these are very, very expensive patients to treat when they're old and in nursing homes and have COPD. These are also the patients, by the way, that got decimated with coronavirus because they're already predisposed to lung damage. So they're sitting there waiting for us to launch, and they also have a buying group that controls about another 100,000 plus beds, nursing home beds. So that'll be where we start.
Thank you, Cliff. We just ran out of time, so thank you very much for joining us here. Thank you. Thank you so much. All right. In just a moment, we'll be joined by Anna.
Hello.
Yes. And the startup Cotum. So take it away. The stage is yours. 3 minutes for you.
Okay, so my name is Anna and I represent the company Cotum. And the market we're trying to... I'm sorry, just could you please, I guess I have, sorry.
No worries.
I'm very sorry. I have so many pitches this week, and
Not
I've
this paycheck.
accidentally opened another one that I don't need today.
Entrepreneurs
So
are very busy, so
yeah,
I totally
sorry, too
understand.
much.
No worries. I
Yeah, we
stopped the
just had.
clock.
Thank you very much. I just had my local also pitching today in here in Latvia. So yeah, so sorry about it. And yes, let me make sure. Yeah. Oh, just yeah.
Okay, I
Okay.
am resuming the clock. Okay, so
Sorry about it.
no worries.
So the problem we wanted to solve with our innovation is implant failure. And in dental market and also orthopedic market, the prevalence of peri-implant diseases is 10%. That means that 10% of the implants actually failing after the implantation. And currently on the market, the solution is pretty standard from all the manufacturers. It's titanium alloy with some surface treatment or coating and with limited bioactive properties and guaranteed metal to tissue contact, which will only promote these problems. And here comes Coatum solution. Our coat, we have developed a drug delivery coating, which is like a sandwich. It has 3 layers. First one is isolation layer, which locks the metal in and doesn't let it promote unwanted immune response. Then we have a calcium phosphate layer, which is material closest to bone, which will further promote osseointegration, and a drug delivery layer where we impregnate a medication in the coating, and it will promote osseointegration, angiogenesis, antibacterial properties, and other desired features, as this is a customizable solution, so you can also customize it. And this gives us superiority in adhesion and strength. Coatum also reduces infection, it reduces inflammation and metallosis, it promotes osseointegration, and reduces costs. And our key numbers to date from our trials is that in animal trials, healing time decreased from 3 months to 3 weeks. In pull-out strength testing, we show twice as better results than the industry standard. And in dental and orthopedic case studies, we have shown up to 50% healing time decrease. And we have partners all over the world. These are clinics who want to run clinical trials with us, and implant manufacturers who want to make a case study with us and later license our technology. This is our great team. We have a team of businessmen, physicists, and medical doctors who work all together to bring this innovation to market and to clinical practice. And also our advisors who worked in the greatest industries, manufacturers like Zimmer Biomet and AstraZeneca, who provide us with a great experience. And finally, our call to action, we're looking for funds. So we're looking for 1.5 million euros currently for certification, clinical trials, and moving to orthopedics market. And for partners who want to partner on clinical trials with us or want to apply our coding solution. So thank you very much.
Thank you, Anna. We are already in the Q&A, so who would like to start from our judges?
Maybe me. Who is your competitors? As I'm not an expert in this subject, but as far as I know, my dentist also offered me some kind of the solutions that will slowly release drug. And what is the difference here? Or do you have any competitors on the market already in this area?
This is actually very interesting, as for our market research, we do not know any companies that are doing what we do, like in the terms of the implantation and the coding around it. As it is like you implant it and it works, and you can apply it like a crown and the abutment on the top. So this is a pretty new solution, and yes.
Okay. Yeah, Shimon, I can see that you unmuted.
Okay, great. So, do I understand correctly that you simply add a coating to a standard titanium alloy implant? And if so, then what is the reason for the cost reduction that you mentioned in your presentation?
The cost reduction is that compared to, first of all, in the manufacturing process, if we compare it to other coatings applied, our coating is thinner, it uses less material, therefore it's flexible and stronger. And as well, this coating does not require any pre-surface treatment, no grid blasting or sandblasting, so the process is shorter on the manufacturer side for now. And also the reduced costs comes from the fact that our implants integrate faster and better, and it's less probable that you will need a resurgery for the patient.
All right. Maybe Caitlin, do you have any questions for Anna?
I am trying to formulate my question, but the only thing that is still a little bit unclear to me is how big is this problem and whose problem is this exactly? Are you solving something for the patient or for the manufacturer saving costs, or is it more I'm still looking a little bit who's benefiting from this the most?
Where I'm going to say that everyone will benefit from it, as for the patients, that some patients lack the personalized approach, like smokers or diabetes patients. They are in a risk group, and they need a more aggressive approach in terms of osseointegration to be faster and stronger. And for manufacturers, we're solving that. It might be not the most forward problem in the dental market, but as I mentioned, we want to move to orthopedics market, and the dental implant failure is quite big there. And for example, Johnson & Johnson was paying $2.5 billion of lawsuit due to faulty hip implants, as they were failing and not healing properly. So we want to solve the problem for everyone, both for manufacturers and for patients.
Thank you, Anna. Just in time. Thank you so much.
Thank you very much.
Okay, this time we'll be joined by Dovidas from Legends. All right, I think it takes some time in there to dial in. Hello, Dovidas. We're waiting for you to share your screen so that we can start.
Hello, Dzień dobry. Yeah, thanks for having me today. I remember that back in med school, my professor told me that people are usually afraid of dying from cancers. However, they end up dying from cardiovascular diseases. And this is no secret that cardiovascular problems is still the #1 killer in the world. We get millions of new cases every year, and that costs our economy billions of euros. However, many of these diseases can be prevented with timely diagnosis, and the first choice method here is the heart ultrasound imaging. Note how this physician is holding a tiny little probe in one of her hands, and then she places that probe on a chest of her patient, and then she gets these two-dimensional moving images on a display of an ultrasound machine. The problem with this examination is that it takes a lot of time to complete. It takes from 30 to 90 minutes, and it's mostly manual work. You have to work a lot with pressing all those tiny machine buttons to come up with accurate diagnosis. Moreover, a physician must be a very skilled one to have a large expertise in the field, and the bottleneck is that patients are forced to wait for 5 weeks in order to get admitted to a hospital for this examination. Now, our solution is quite simple. We're using a deep learning neural network technology that basically recognizes all of these standard heart image views and then performs the automatic analysis of them, all of the required measurements without human input. So instead of doing this examination for 30 minutes, now you can do it in 5 minutes. Our business model is that we integrate our solution into picture archiving communicating systems. Those are basically large platforms where hospitals store their images, and they can open them and review them, annotate them whenever they want. Our end users are cardiologists, and we sell our solution to hospitals signing a 3-year contract, and we charge for installation and a support fee. What sets us apart from our competitors is that we're focusing on a full heart ultrasound examination protocol. Now, our competitors are doing only the fractions of it. However, our ultimate goal is to come up with a full solution for hospitals that anyone can benefit from. Up to this day, we have very nice traction. So we launched back in 2019. However, we have recently secured our pre-seed funding round of 360,000 euros. At the same moment, we're running several clinical trials in different hospitals in European Union. We have our first use case in Australia. And parallelly, we're running a clinical trials to certify our solution to get it a CE mark. At the same time, we're integrating in a lot of different PACS providers to give us larger networks of hospitals using those systems and to reach our end customers much more easily. We plan to launch into the market next year around April or May. Meet our team members. What is unique about our team that we're all everyone from our team is a medical doctor, and in the past we have had several experiences, quite a lot of experience with deep learning projects, and we exactly know the pain points in the healthcare system and how to tackle them with AI. Thank you very much, and I'll be happy to answer your questions.
Great. I mean, I'm wondering if you somehow see my phone because you all finished in time, right? Like you saw it. So we can move now to the Q&A. I set the clock to 4 minutes. Are there any questions from our judges? Caitlin?
Hey, thank you so much for your pitch. Really clear, especially for someone who's not a certified doctor. I have a question around your unit economics. Can you tell me a little bit about pricing? What does it cost? Do you produce these machines yourself, or are you having a contract with a manufacturer? Can you tell us something about that?
You're talking about ultrasound machines, right?
Mm-hmm.
Okay,
so you're not making the machines, it's the
we're
analysis,
not making the machines.
Right?
We're making the software that analyzes the machines. Yeah.
Okay, then it's a very easy question being answered. So I'm handing it over to someone else.
Okay. Thank you very much. My question is about the accuracy again of the results and how much data do you analyze and to be able to come up to some real accurate results, because this is the biggest problem to have the trials before the patient data and be able to believe that the deep learning will be better than the doctor.
Okay. The interesting thing is that, for example, two cardiologists producing, the same analysis will offer around 30% differences in their final results. So for our case, what we're doing, we are training our algorithms and comparing them against human operators. So we have 5 different cardiologists manually labeling all of the images, and then we measure the standard error of measurement for each measurement we do. So currently we have at least 90%, and we plan to reach it up to 95% as soon as we have all of our patients waiting in the pipeline, the patient data to be uploaded, and the neural networks will be retrained. So in terms of accuracy, I can frankly tell you that right now it's 90%, and it will be 95% as soon as we have our CE mark.
Okay, but the 90% accuracy means recognizing all heart disease or just one particular heart disease based on the ultrasound?
The funny thing is that we're not interested in diagnosing diseases. We're interested in doing the measurements itself. We're not diagnosing here. We're leaving the diagnosis for a physician to decide. We're simply eliminating manual work. So if one cardiologist does not agree with another cardiologist, in 30% of cases, then we don't expect AI to be as clear as those two cardiologists. So we have someone in between.
Okay, so just to make sure, you are just measuring various parts of hearts, yeah?
Yes, and we leave those measurements to be also, corrected by a cardiologist later. So he or she always has an opportunity and ability to fix if they think that AI has done, a terrible job.
Okay, so what uniques you with the other projects based on the image recognition and measurements, which is quite standard at the moment, the deep neural language processing based on the image recognition in that area?
There are a lot of startups that are dealing with deep learning in medicine. However, most of them are focused on, for example, finding a lesion in neck checks, X-rays, or CT or MRI. And does that create any value at all? Because spotting a lesion for a radiologist takes, for example, 5 milliseconds. But performing these measurements in heart ultrasound actually takes from 30 to 90 minutes to complete. So there's a lot of heavy manual load. And so our clinical value, what we bring, is that we allow medical doctors to skip these measurements and then therefore perform the examination faster. Is that what you're asking?
All right, we ran out of time here, but thank you very much,
Thank you.
Davidas, for answering the questions. And we'll now move to the next startup of the day, sixth startup in the finals. We have 8 in total. It's Wojciech from Team Stormer. Are you sharing your screen with us?
Not yet, but I'm actually about to. Let me know if you can see my screen.
Yeah, we can see it, and you can start now.
Okay, thank you, guys. So let me introduce Team Stormer. And let me start with saying, how we came up with the idea, okay? Our mission is actually help people build successful products. And the story is that, we actually run a small consulting and training company you can see on the right, Rokanan. And we simply help people, with innovation and product development. On the left-hand side, you can see we're also in the leadership of one of the most recognized non-profit communities. This is me actually delivering a conference last year. And this is R&D, innovation, and product management people, right? So this is how we found, and actually this is not, you know it very well, this is not actually a rocket science to say that actually developing new products, it's actually a very risky process. And I obviously show it on the very recognized design process, design thinking process, that there are many pitfalls when you develop products. But what we actually found that most of the tools, we wanted to build a tool for product developers, but we just realized that competition, and you can see on the right a couple of examples. I have 2 other slides, deep dive to the competition. Obviously no time yet for this, but we realized that those tools actually focus on rather on the on either ideation or implementation side, and nobody actually deals with the fuzzy front end, right? This is called fuzzy front end, so simply how to analyze problems before you even try to solve them, how big those problems are, how common are those problems, because even if you find the right solution, if there is not many people who find this problem accurate, there is actually no commercial value for the product, right? Or not enough. You see, this is just some common competition. Some examples, and just to say that the market was estimated 3 years ago to be like $1.5 billion. So even reaching 1% means it's $15 million, right? And so, of course, we haven't started. Obviously, we didn't try to actually implement everything at the same time. So we broke down the implementation of our solution into 2 modules. First one that is already on the market, you can see a screenshot from it on the right side. It's actually ideation, idea selection. Why? Because it's the easiest one. It's actually it was actually easiest to reach the market. And another one that we plan next is actually AI-based problem analysis. I mentioned how to analyze if there are problems actually known on the market. You can you can ask using natural language recognition. You can see if people discuss certain topics on forums. You can see if in the articles some topics are being discussed. And obviously we can even go in the first module when you can have advanced customer need analysis, so you can have like a full end-to-end process of just on the fuzzy front end before you even go to the prototyping, right? Here are a couple of customers that tested and used Team Stormer. Carl Zeiss actually using it right now, and then find our MVP very appealing. And just last thing is that we obviously mentioned that we have a company and we are in the professional community of these people globally. This is more than 20,000 people globally. So this is our main network. Sales channels. Obviously, we cannot forget about digital marketing and sales. So this is the first channel, and we want to obviously focus on those countries where R&D spendings are the biggest, and those economies where they're open for new tools. Coronavirus actually speed up things because people right now look even farther into remote distributed work, and especially in R&D departments, it's it's not that obviously that feels like mural, but it still require having everyone on the same call, right? So this is us. This is a couple of feedback that come from people who we discuss, and we analyze if they could find this solution useful. You can see R&D directors of various companies, even big corporations, look for tools like this. And this is the team. Myself, Wojciech actually sitting next to me, who is actually experienced project manager in IT. We're all from IT, and another guy from Krakow, Piotrek, who is very experienced in developing advanced software, for industrial systems, haptic interfaces, educational systems, so very, I think, right people with competences, they complement each other, right?
Yeah, we have 2 minutes and 20 seconds left for the Q&A session because
Okay.
yeah, we are slightly delayed here. So if our judges would like to ask some questions, we have 2 minutes for that. Okay, Grzegorz?
Yeah, your business model, how much does it cost? And do you sell it as a SaaS or as a consulting project? And is your software cloud-based or not? And is it working already? And do you have customers that made already go through it? And what was the result?
Yes. Okay. So there are two models. One is actually two sort of plans. One is cloud-based subscription model. Monthly subscription. Carl Zeiss is already regularly paying, and actually they are planning actually to upgrade and buy additional licenses. It's R&D department from Carl Zeiss. There's obviously a lot of beta testers and people who helped us to test the idea before we launched. All was very keen, provided us a lot of feedback. Another model that we consider is not yet in place. It's actually on-premise installations for certain R&D departments. You can imagine they just have security is very important in R&D, and we envision that there is enterprise implementation. Companies like, let's say, Rolls-Royce, or where certain security measures are super important. We can deliver, and we are ready actually to deliver installation on their own for them. Okay.
We have 40 seconds left, just letting you know because you cannot see it. Are there any other questions?
So what is the monthly price of this, and what is your average number of seats? So what I want to know is how much do your customers pay on average for this product?
Okay, so one seat is $20 per month. And there another plan is actually 5. We have one, then another one is for 5 users, and another is for 10 users. And I mean the cloud-based, right? Because on-premise installations we can customize it, and but you pay just for the person who's actually setting up sessions, brainstorming sessions, and evaluation sessions. So he can invite, depending on of the seats, and depending on the plan, he can invite from 5 to 20 people to the session, Wojtek. And you don't pay for those.
Unfortunately, we ran out of time. I cannot allow this because we have to be fair with other startups. So thank you very much for joining us here.
Thank you very much.
Thanks a lot.
Cheers.
Thank you. Okay, now we are joined by Anna. Hi, Anna. Are you sharing your screen? We cannot hear you. Maybe you're muted, or do you have some headphones, perhaps? No, we cannot hear you. So maybe we could switch. I hope that my team that is producing this can agree with me. Maybe we should switch the order, as we have Martin here already. Hello, Martin.
Hi guys, can you hear me?
Yeah, we can. We're waiting for your presentation then.
Okay, it's a great pleasure to be here. Thanks for having me again. And here we go. Joints. Joint is a platform for online events that require long-term community engagement. And here's what this is all about. Every platform that we're dealing with right now basically obliterates the community as soon as the event is done. And we argue that the event community is actually the most precious thing we're trying to build here. It's not so much about content. We think that content is overrated. You can see content on YouTube later until you pass out. But it's actually the people that we want to get involved in. So what Joint does is it lets you build bespoke workspaces in which the events can take place. And for each customer, this workspace can be different. So from the typical things that event platforms do, like you manage attendees, speakers, you have webinars, this is all we do, obviously. You then publish the cover pages, but then, sorry for that, then comes the interesting part. We can store and organize best of the content in our own library of contacts and knowledge, and we can network also after the event. So if you guys have a question for me, like 3 weeks down from here about the platform, you can still meet me at the Joint table, which is still active, and I can actually drag this Joint demo table around multiple events and keep all my contacts with all my customers I've ever had. So this is essentially how it works. So it nurtures the communities. And this is a bit of a philosophical thing for us also, because we think that in this day and age, the communities is really precious. Like this is what basically, especially after COVID, the fabric of the society has been torn apart and communities have nowhere to hang out in, and social media tools fail us miserably. So you can build any social space, business space, simple, complex, a ticketed conference, a co-working space, a workshop, a webinar. The business model here is rather simple. It's a SaaS freemium model with less than a certain amount of attendees. It's free, then past that it becomes paid. You can charge commission on event tickets, like just a cut of what you sell through Joint. But this one is very interesting. The third one, you can selectively monetize content because we have a deep permission layer that lets you put paywalls at every level of an event. So you can have a chat, for example, with an expert that charges at that event because he is so awesome and he gets to charge. And all of the rest of the event is free. So you can put these paywalls wherever you want, also at the front gates if that is your intent. But because of the deep permissions, that is possible. So we're currently implementing Joint for one of the big 4 accounting firms for the learning and mentoring departments, leading venture hub in Warsaw, a well-known certifier of eco-food producers. This is a kind of a big deal. We hope this comes through, but we're designing these spaces for the people. So the alpha version is already out. These are actual screenshots. And as to the this is what we seek, 250k euros for 10% equity and a strong partner to take us to round A. And the team is quite experienced. We have put up 2 SaaS companies in the hotel industry. In certain configuration of the people here, not everyone was involved. But I myself have always been working in IT for a good 10 years. I'm an ex-coder and now a business developer. So I'll now take your questions, and thank you so much.
Super, thank you very much, Martin. Okay, so straight to the questions. Who'd like to start?
What is your sales strategy? It's a hot topic solution now at the moment. There's lots of solutions similar, but what is your sales strategy actually to become the first choice software for the online events and the collaboration?
So we're currently doing a lot of groundwork with clients to see what exactly is the overlap in each one of them, so we can focus on these features and then push them out in form of a SaaS that is very easy to configure. So you simply set up templates that are also an unqualified person would be able to do. So this is not a direct answer to your question, I understand, but the stage that we're in right now, we're launching this year. Before Christmas, we should have the whole thing live. So we're working with at least, I think, 6 or 7 clients, and we're setting up the spaces for them and see how they will interact with them so we can optimize the whole machinery. But it also runs on a very bespoke backend that we've been working on for at least 4 years. So this is not some ordinary, run-of-the-mill, oh, we want to be part of the event community and online stuff too because of the COVID. Like this was something that we were very philosophically involved in, so to speak, as to how to represent very complex contextual spaces in which we dwell and events are such spaces, actually. So I've actually put up several articles on Medium about this sometime last year, and now it's also coming into limelight, the problems that we have with social media. So it's kind of around that space. I'm sorry, I know I talk a lot, but
thank you.
I try my best.
That's great when pitching. Come on. Okay, so we have 1 minute left. Any other questions, Caitlin? I can see that you're unmuted.
Yeah, I mean, I'm pretty passionate about this topic. It's really difficult creating a community. And what is not really clear to me is that you're saying your unique selling point is that community piece. But I still wonder, how do you actually help clients nurture these communities? Because the only thing that I got was that you leave these spaces open longer after an event. But still, like, the clients are still required to put in a lot of effort. How do you actually really help those clients achieve that?
Yeah, so currently we hold their hands basically, and we help them set up the space so they can learn what is their kind of a repetitive mode of operation. So, for example, if you have a startup accelerator, they will have repetitive events, and then they will interact with startups that are part of the accelerator. So these startups have their bespoke workspaces within the space of that event. And then, for example, I think this is a good one, you have your personal inbox as the host actually collects all the communication with every single one of the startups. And the startups have direct communications with you within that space. And so you can invite everyone to an event if it happens to be a video webinar or whatever. But in the meantime, it's a functioning workspace that could be compared to I don't know, Microsoft Teams probably, but we like to think of it that Joint would be like the Teams if Apple has made it. It would be kind of like a full version.
I am very sorry, but I have to stop you right here. We ran out of time, but thank you very much for your pitch. And now we will move back to Anna and see if we can connect in a way that it works. Hello, Anna.
Yes, can you hear me now?
We can hear you now.
Yes.
That's perfect. All right.
Good.
So
I'm going to share the screen.
Share your screen.
Okay. I'm going to share my screen here. Can everyone see my screen?
Just hold on a second, and it should be on. I think it is. Yes. Okay. So you can start now.
Yeah. Hello, everyone. We are Ino, and I would like to start talking about endometriosis, or the presence of endometrial-like groups of cells outside the uterine cavity. And the symptoms go through painful periods, excessive bleeding, infertility. Now, I would like to ask to all of you to think about 10 women you know. Your mother, your sister, friends. What if I tell you that it's almost certain that at least one of them has this diagnosis? This is the actual prevalence of endometriosis. 1 in 10 women have it. And the typical patient journey goes through, on average, 8 doctors. And in this case that I'm showing, this is a real case. It took 17 years to have a correct diagnosis. And you see, we have these painful periods, and society tells us it's just normal. It's just part of having period. And we think, yeah, okay, it's normal. And you may think 17 years, wow, that's a lot. But the truth is, it takes 10 years on average to have a correct diagnosis in the whole world. And the financial burden that comes with it is huge, not only for the individual, but also for the healthcare and the society. So this is the wake-up call we want to bring. Stop normalizing your symptoms. Ino wants to break the vicious cycle of misinformation around our menstrual symptoms by lowering down the barrier for affected women to seek early specialist advice. And how are we going to do it? So it's based on 4 key points of integrated care. First of all, we have a highly personalized symptom tracker. We track the symptoms that matters, and we offer a personalized recommendation of diagnosis after 3 months of continuous traction. So we also take care of your pain. We offer a holistic solution of a complete 28 days cognitive behavioral therapy intervention, split in audio sessions of 50 minutes, clinical proven to control the pain. And when we say we are backed by science, yes, we work together with the University of Melbourne, developing a co-pilot project, and we perform a minimal clinical study with 6 women, with all of them perceive the content of the audio as helpful for their pain. And we also alongside have nutrition tips specific for this market. And we are not just a period tracker. We position ourselves as highly medical and highly personalized for this untackled market. We aim to convert 15% of the 6 million women that are suffering from menstrual pain. And with a subscription model of $59.99 per year already tested, in 2023 is our year. And why so? We are a medical certified product and we reach our break-even point. My name is Katarina, I'm the CEO, and I'm backed with these amazing and highly expertise women by psychologists and medical doctors on the field. And we are aiming for a seed funding of 500K to launch our MVP in January 2021. If you resonate with our cause, join our mission and helping women conquer their menstrual pain. Thank you.
Thank you. So, Katarina, sorry, I didn't know. Yeah, we can move straight to the 4 minutes of Q&A. Are there any questions?
Yeah, for maybe first one from me. So basically, can a physician actually use the data tracked by a patient to get some further diagnosis?
So yes, so basically one of the biggest problems also comes from the women cannot describe to the medical doctors how do they feel. So the idea is also makes this collect all the data that have been tracking and convert in a PDF, and they give the possibility to export and share with their medical doctors. And by then they can make the diagnosis.
Okay, thanks.
I have a question because I know a couple of these apps, and actually the tracking and the individual components seem like a couple of other apps are doing this already. So what makes you unique is combining them, I guess. And then my follow-up question is, like, is that so? Or is there something else that makes you unique? And and on top of that, I wonder how you came to 60 euros per year for the patient or the user to use it, because I think this is the monetization problem of a lot of these apps. Are women actually willing to pay 60 euros? How did you define that?
Okay, so to reply the first question, most of period tracker apps, they have the tracking option, but it's all too generalized, and they don't offer recommendation of diagnosis that we do. We are focusing mainly in the symptoms related to endometriosis, such as pain during sex, that other apps don't offer. So by being this exclusive to this niche, to this target group, that is like, this is the most common disease that no one heard of. And so by being working in this niche, we are become super personalized in terms of symptom tracker. And this is what differentiated for us. And to reply the second question, so women, the alternatives that they have, these women after surgery to remove the endometriosis, they go on birth control pill, and they don't have another alternative. And we provide that by giving CBT and also nutrition tips to help them sustain the therapy. And right now they pay for their own birth control pills in an extent of 80 euros per year. And by being such a personalized, and we tracked these pricing points while we were performing our sprints, a prototype, women were actually all of them, the 60 customer base that we already have, said that yes, they gave us a range for pricing, and that's why we reached this.
We've got 1 minute left. Any other questions? That's always a good sign. I keep saying this. If there are no questions, it means that everything has been answered. But you still have some stage time. Would you like to share anything else with us?
Well, I'm so sorry for before, and I really hope that I passed the message.
It happens.
I will have the last one. You mentioned that you're collecting the money for the MVP. So do you actually perform any clients reviews or POC? So some kind of researches how the customers are behaving on this application?
So yes, we did several prototype sprints. We reached the final validation of the product, and we have a really intimate contact with our users because they resonate so much in the app. There's no specific for them right now in the market. So by resonate so much with our app, they keep in touch with us, and they already told us several times that they want to use the app.
Okay. We ran out of time now, so thank you very much for your pitch.
Thank you.
I think you're somewhere around here, right, in Warsaw?
Yes.
Yes.
Yes, I'm in a pitch stage.
Yeah, you're pitching from a different room in the palace. So thanks a lot. Thanks a lot. All right. So this was the last pitch of today, of the finals of the Great Pitch Contest. And once again, I'd like to thank you, our wonderful judges. Caitlin Das, Startup Growth and Partnerships at HubSpot for Startups. Grzegorz Pawlicki, Head of Innovation, PKO Bank Polski. And Szymon Kwiatkowski, Investment Manager at EIT Inno Energy. Thank you so much. Thank you very much for being here with us.